Sarah first noticed something was wrong during her sophomore year of college. What began as occasional drowsiness during afternoon lectures gradually escalated into something far more concerning. She would find herself falling asleep in the middle of conversations, during meals, even while walking across campus. Her friends initially joked about her ability to sleep anywhere, but Sarah knew this wasn't normal fatigue. The overwhelming urge to sleep would strike without warning, leaving her feeling helpless and embarrassed. After months of struggling academically and socially, she finally sought medical help and received a diagnosis that would change her understanding of her own body: narcolepsy. Narcolepsy is a chronic neurological disorder that affects the brain's ability to regulate sleep-wake cycles. This condition impacts approximately 1 in every 2,000 people worldwide, yet it remains widely misunderstood by the general public. Unlike simple tiredness or insomnia, narcolepsy involves a fundamental disruption of the brain's sleep architecture. The disorder is characterized by excessive daytime sleepiness and sudden, uncontrollable episodes of falling asleep during normal waking hours. These sleep attacks can occur at any time, regardless of how much sleep a person has gotten the night before, making it a particularly challenging condition to live with. The primary symptom of narcolepsy is excessive daytime sleepiness, which manifests as an irresistible urge to sleep that can strike at inappropriate times. People with narcolepsy often describe feeling as though they haven't slept in days, even after a full night's rest. This persistent sleepiness can severely impact their ability to concentrate, work, study, or maintain relationships. Beyond the sleep attacks, many individuals with narcolepsy experience additional symptoms that can be even more frightening and disruptive. Cataplexy is perhaps the most dramatic symptom associated with narcolepsy, affecting approximately 70% of people with the condition. This phenomenon involves sudden muscle weakness or paralysis triggered by strong emotions such as laughter, surprise, anger, or excitement. During a cataplectic episode, a person might experience anything from slight muscle weakness in the face to complete collapse, though they typically remain conscious throughout the experience. The unpredictability of cataplexy can be particularly distressing, as it means that moments of joy or surprise become potential triggers for physical vulnerability. Sleep paralysis represents another frightening aspect of narcolepsy. This temporary inability to move or speak occurs when falling asleep or waking up, leaving individuals conscious, but unable to control their bodies. During these episodes, which can last from several seconds to minutes, people often experience vivid and sometimes terrifying hallucinations. These hypnagogic hallucinations can involve visual, auditory, or tactile sensations that feel completely real, adding a psychological burden to the physical symptoms of the disorder. The fragmented nighttime sleep experienced by many people with narcolepsy further compounds their daytime difficulties. Contrary to what one might expect, individuals with narcolepsy often struggle with poor quality sleep at night, waking frequently and experiencing disrupted sleep cycles. This creates a vicious cycle where poor nighttime sleep exacerbates daytime sleepiness, while the altered sleep-wake rhythm makes it even more difficult to achieve restorative sleep. Understanding the underlying cause of narcolepsy has been a significant focus of medical research. Scientists have discovered that the condition is primarily linked to the loss of hypocretin-producing neurons in the brain. Hypocretin, also known as orexin, is a crucial neurotransmitter that helps regulate wakefulness and REM sleep. In most cases of narcolepsy with cataplexy, there is a dramatic reduction in hypocretin levels, often to less than 10% of normal levels. This deficiency appears to result from an autoimmune process where the body's immune system mistakenly attacks and destroys the hypocretin-producing cells in the hypothalamus. The diagnosis of narcolepsy requires careful evaluation by sleep specialists, as the symptoms can overlap with other sleep disorders and medical conditions. The diagnostic process typically begins with a detailed medical history and physical examination, followed by specific sleep studies. The Multiple Sleep Latency Test is a crucial diagnostic tool that measures how quickly a person falls asleep during daytime naps and whether they enter REM sleep abnormally quickly. Additionally, cerebrospinal fluid analysis can measure hypocretin levels, providing definitive evidence of the neurochemical basis of the disorder. Living with narcolepsy presents numerous challenges that extend far beyond the physical symptoms. The unpredictable nature of sleep attacks and cataplexy can make it difficult to maintain employment, pursue education, or engage in social activities. Many people with narcolepsy face discrimination and misunderstanding from others who perceive their symptoms as laziness or lack of motivation. The condition can strain relationships, as family members and friends may struggle to understand the severity and involuntary nature of the symptoms. The emotional and psychological impact of narcolepsy cannot be understated. Many individuals experience depression, anxiety, and social isolation as a result of their condition. The fear of having a sleep attack or cataplectic episode in public can lead to withdrawal from social situations and a significant reduction in quality of life. Children and adolescents with narcolepsy face particular challenges in educational settings, where their symptoms may be misinterpreted as behavioral problems or learning disabilities. Treatment for narcolepsy typically involves a combination of medications and lifestyle modifications. Stimulant medications can help combat excessive daytime sleepiness, while other drugs may be prescribed to address cataplexy and other symptoms. Sodium oxybate, a medication that improves nighttime sleep quality, has shown significant benefits for many people with narcolepsy. However, finding the right medication regimen often requires patience and close collaboration with healthcare providers, as individual responses can vary considerably. Beyond medication, lifestyle strategies play a crucial role in managing narcolepsy. Maintaining a regular sleep schedule, incorporating strategic napping into daily routines, and avoiding triggers for cataplexy can help individuals better manage their symptoms. Support groups and counseling can provide valuable emotional support and practical advice for coping with the challenges of living with narcolepsy. Despite the significant challenges it presents, narcolepsy is a manageable condition with proper diagnosis and treatment. Many people with narcolepsy lead fulfilling lives, pursuing successful careers and maintaining meaningful relationships. Increased awareness and understanding of the condition are essential for reducing stigma and ensuring that individuals with narcolepsy receive the support and accommodations they need to thrive. As research continues to advance our understanding of narcolepsy, there is hope for even better treatments in the future. Scientists are exploring new therapeutic approaches, including immunotherapy and hypocretin replacement therapy, which may offer more targeted and effective treatments. Until then, education, advocacy, and compassion remain crucial tools in supporting those who live with this complex and often misunderstood sleep disorder.